Hello, this is Lindsay Schmad, and I am going to provide a voiceover and discuss some of the changes that are being proposed for the current curriculum. I'm going to start with the major changes here and then explain some of the other changes. So, it was discussed on our BSN curriculum day that some of the OB content needed to move farther up in the curriculum, so that's not all happening at the 400 level and more threaded throughout. So we talked with faculty, both 200 and 400 level, to discuss in particular what they thought should be moved. So some of the ones that we landed on in particular were regarding the normal assessment, normal pregnancy, normal newborn, things without complication, as in 200, they're just starting a lot of their med-surg content. So it should be basic content, not complications, which would be reserved for 400. So with that discussion, it came about that Loudermilk has specific chapters dedicated to certain topics, and some of those topics have been paired together. So with approval of this shift in content, the 200 faculty and the 400 faculty would need to meet and discuss kind of the specifics as far as labor process, oxygen pathways, which of that content specifically is going to live in 200 and which is going to live in 400 for the mastery. Same thing with nursing care of the family and newborn. We're talking about normal adaptations of the newborn versus complications in 400. So highlighted in green here would be the things that would be added to 200, such as the labor process, oxygen pathways. This is simply an introduction. They will be attending a clinical experience in which Women's Hospital will be holding a specific labor and birthing class for our students only, as well as a newborn feeding or breastfeeding class. So we do want that content to move to 200 so that they are introduced and more exposed. Nursing care of the family and newborn, this would be normal adaptations of the newborn, as well as mom, baby, family. Postpartum physiology and assessment, this would be split between 200 and 400, again, focusing on normals in 200, and then complications with 400. So we also thought that mood disorders would be appropriate to move to the 300 level and tying into some of that content that's discussed. So those are the major changes that would need to happen regarding the OB content and newborn content. But in order for that to happen, we do need to shift some other things in 200 because we know that 200 is kind of overloaded already. So we looked at some of the population health concepts and topics, such as health disparities, determinants of health, cultural respective care. And we identified that a lot of these things we're already discussing in a clinical experience or community experience. So we wanted to take those from the classroom and tie it into either a post-conference discussion or reflection on the community day, because we know this information is important, and absolutely you can continue to talk about it in class. However, we don't necessarily need a full lecture on it. We talked about a few different options. If you wanted to record a lecture on the topic and require it as a ticket to their community clinical day, and then you could either have a discussion about it and tie it into your clinical experience, or you could post a little quiz if you're using it as an assessment piece. So health disparities, again, is leveled across, kind of building within each level from POP 1 to POP 2 to POP 3. Same thing with determinants of health. So we're not really voting on how you would implement the change. That's kind of up to you as faculty, but we're just creating space in order for these other content topics to move. Along with determinants of health, you can see that it's tied into Pop 3 and Pop 4 for the scholarly paper. I'm going to try and use my cursor here. So, and then also Pop 5, it's very heavily tied into the PFP project. A few small changes, culturally respective care. We talk about that pretty much all throughout. So it is often discussed in clinical paperwork. So I think it would be a good place to keep it as a discussion piece and tying it into those clinical experiences. For the concept of perfusion, we identified that we were only talking about peripheral vascular disease, and it's kind of hard not to talk about peripheral artery disease. And health assessment, we discuss both, we compare both. So simple add there. We also discovered that in Pop 3, acute renal disease may have been left out in some cohorts. So acute kidney injury, acute renal disease, that was on the curriculum grid already. So somehow it just got lost. So we just made a note to add that there. Cognition across the lifespan, we removed dementias because this is already taught in 102. So we didn't need to repeat that in 200. And it goes along nicely with their clinical experiences that they have in the 102 level. Nursing care of populations with anxiety disorders. Again, stress and anxiety was already taught in 102, so it's a repeat. We discussed that we did not need to reteach it in 200. Again, it's okay to review things and when you're building on concepts, but recognize that they've already had that content, so you don't need to reteach it. It's just a review or bringing in that content to another topic or concept that you're already discussing. We did remove behavioral disorders in critical care environments. That's already covered in 200 and 300, along with substance abuse, intimate partner violence. We talk about delirium. So we removed that from 400 because it's already covered in 200 and 300. We discussed cognitive disorders. We discovered that somehow along the lines this got lost as whether it was on the curriculum grid. However, I'm not sure if it just we decided that wasn't important or kind of got lost. But anyways, it was voted and approved. So we thought it would be really easy to tie in these cognitive disorders with either our pre-labs, lead screenings and reflections. We talk about learning disabilities and how that affects their brain. With lead, we could tie the Down syndrome content to their Down Syndrome Alliance clinical experience, as well as the cardiac congenital abnormalities that they discuss there. And so for 300, it would be really simple to either add a video or a voiceover for those other things, such as autism and ADHD, could tie into some other concepts as well. Genomics, this was an online clinical post-conference in the past, so we're just making notes for 200 faculty to keep that there. For the surgical client, we just highlighted that we wanted to make sure drains were addressed in skills as a new skill. Family as client and community as client. Again, these are ones that could be tied into clinical faculty post-conference discussions. We want to make sure that all adjunct and faculty are addressing this. And so we want kind of a standardized post-conference discussion, or somehow all students are guaranteed to get that content either through a recorded lecture, flipped classroom, or whether all clinical faculty are discussing the topic in a post-conference discussion. So those are the major changes. Again, it's not, when you look at this, it can be overwhelming, but overall it's not a lot. Actually, it's freeing up some time through all Pop Health courses, and particularly for 200, in order to get that OB content moved to 200, we would need to move some of these other things into post-conference activities so that we're still getting the content to the students through some sort of discussion, but not losing sight of leveling things across. So I do have another document that I will share and discuss. It's a Word document, and so for each population health course, it lays out the specifics of kind of this document. So hopefully this helps kind of clarify what's changing or what's being proposed to change. Again, this would be for fall traditional and ACE 102 and 200. Pop 4 for traditional and Pop 3 would stay the same, with the exception of the AKI and the mood disorders, I believe. So 400 would teach the OB content just like they have been. 300 would add the AKI and mood disorders and the cognitive disorders. And then 102 and 200 would start with the OB content. That way, we're not losing content for cohorts, and it's an easier gradual change for 400 to take care of those students as well and not get lost. So hopefully this helps. If you have questions, don't be afraid to ask. But yeah, I will also do another video with the Word document as well.